Good morning, good afternoon, and good evening, ladies and gentlemen. This is Professor Handa from Kampala, Uganda. I'm sending messages to our colleagues in Ethiopia. This is a TOT, training for trainers for the future leader of 5S-KAIZEN TQM for the betterment of hospital management. Next, please. So, the topic which we handle is 5S and Kaizen. As you can imagine, those are very fundamental and universal and simple and effective managerial tools. Next, please. What is 5S principle? Originally, this was developed in Japan, as you can imagine. We use the Japanese term in our country, but in every country we should have a respective local language. So, in Japanese language, seiri, seiton, seiso, seiketsu, and shitsuke. Then we created the English version, as you could see here: sort, set, shine, standardize, sustain. Next slide, please. If you come to Addis Ababa, for example, you will have Amharic language. This is an example of the translation of sort, set, shine, standardize, sustain. Those scripts are written by me because I'm not using Amharic language for daily lives. I'm not sure whether it is readable or not to you, but we need to respect our local culture and language, and we use those languages for expressing the managerial tool. Sorting means removing unnecessary stuff and the clutter from our working place. Setting means give proper orderliness to the essential items which we need for the work. Shining, maintaining cleanliness, of course. Then standardizing, make, sort, set, shine as a part of your routine work. Then sustain. We continue our efforts to improve the situation of work environment using sort, set, shine, and standardize. Those are the very simple definitions. I think you can use those definitions in your routine work. So before going to the further detail, it is necessary for us to look into the meaning of management, because we are trying to manage our hospital in a better way. Next, please. Management. What is this particular term? In our country, in Japan, we call it Kei Kandi. Kei Kandi is the meaning of this particular term, English term, management. Then how about in Amharic language or other languages in Ethiopia? So we need to have clear idea using our own language in order to understand the precise meaning of this particular term, management. Next slide, please. Management is a control. What are you going to control? I think it's very clear. We need to control the process. What sort of processes? Next slide, please. If you go back to the Donabedian's definition, in order to define the quality of our healthcare, we use those three words: structure, process, and outcomes. Structure is a kind of the physical facility, equipment, and consumable, and the medical technology which we prepare for providing healthcare to our client. Process is a kind of process of giving those services. Then outcome, we will see the result of the provision of our healthcare. Then if you change your mindset to the reality in each health facility, next slide please, we have those complete set of words: resources, system, outcome. So we have so many different types of resources at the hospital: human resource, physical facility, building, and then equipment, medical equipment and other hospital equipment. And also we have so many different types of consumable represented by drug and medical materials. I think those are the resources. Using those resources, we want to create the services for the benefit of our client. So next please. As you could see here, resources, system, outcomes are one complete set of the linear processes of our managerial work. In order to have a betterment of those processes, we have controlling mechanism of those things. Then we also have a financial mechanism in order to inject financial resources, money to those processes. This is a very simple but universal structure of our managerial process. I think this is very, very important to us. When you ask yourself what the management is, you can imagine this kind of diagram. Next slide, please. As a summary, we would like to just read this particular paragraph. Hospital management is a controlling mechanism of a transforming process of resources to health outcome through the service creation and delivery system at healthcare facilities. We are working for the benefit of the patient, the family, so we need to have the mindset to overview the entire dimension of the management. In this particular dimension, we place a simple and universal managerial tool such as 5S principle, which we have already touched upon in the very beginning of my talk, and Kaizen. Kaizen is a problem solving by the staff for the benefit of staff and for the benefit of patients. Thank you for watching. I think we will go into a little bit of more details in the next video clip. Thank you. Have a good day.